We're restoring function to the typical cervical segments and to the atlas on the axis. We can finalize our evaluation and treatment of the cervical spine by going to the C0-C1, occipital-atlantic junction. We will again use our translatory right to left maneuver. While in flexion, we will hold the head, translate to the left, translate to the right, translate to the left, translate to the right. We want to hold the occiput square and have the atlas move underneath. In this example, however, when we do the translation from right to left, introducing right side bending, that introduces left rotation, not right rotation. In other words, C0-C1 couples to opposite sides, where the typical cervicals in translation couple to the same side. So we will go into flexion and an extension, translate right to left, translate left to right, checking for the behavior of the condyles as they articulate with the superior surface of the atlas. We begin by grasping the sides of the head with our hands so that we can control a rotation forward and backward, a little nodding movement of the head. We envision that the head is going to rotate around an axis through the auditory meatai. And it's just a little rotation forward and a little rotation backward. We will start by rolling his head forward till the first bit.
Be careful of the person's eyes. Wanted to throw that out.
Barrier is sensed. With our fingers underneath the head, overlying the posterior arch of the atlas. And as soon as that begins to move, we are at the flexion barrier of the occiput on the atlas. Then we'll translate right to left, left to right, right to left. His head into extension until we first begin to feel it close on the posterior arch. That's enough extension. And with that much of extension, I'm not putting the vertebral artery at risk. Here we translate right to left and left to right. Now what we're finding with Mark is that while in extension, translating from left to right is free. Translating from right to left, we meet resistance and restriction of range. That tells us that the occiput resists extension, right side bending, and the coupled motion of left rotation. We have not tested for left rotation. We infer that because we know the anatomical coupling that's present. The segment then is flexed, left side bent, and...
Sorry to interrupt for one more second. If at any time you want me just to pause it while you're jotting something down, let me know. Otherwise, it seems like everyone's following along with me.
You guys see the amount of excursion?
Yeah, that was a little much, I think.
And you see actually he starts moving the shoulders. What's stabilizing the lower segment is gravity and the weight of the body.
Yeah.
So you got to go far enough and feel that in.
right rotated. We would then want to identify a muscle energy procedure to treat that dysfunction.